Our dear viewers, welcome to a new episode. Please click the subscribe button to encourage us to publish more medical information. Bone and joint pain is a specific sort of pain which commonly develop in association with certain diseases which affect the function or structure of bones, joints, tendons and ligaments. There are many causes for bone and joint pain. They include 1. Trauma. It's the most common cause of bone and joint pain. So, these body structures undergo variable degrees of damage on exposure to trauma, as in cases of car accidents or falling from height, etc. 2. Osteomyelitis. It's an infection of bone cells and is manifested mainly with bone and joint pain. 3. Vitamin D and calcium deficiency. It mainly affects the bones, as it leads to osteoporosis, which is usually associated with bone pain and less commonly joint pain. 4. Autoimmune diseases, such as rheumatoid arthritis and systemic lupus. In this pattern of the diseases, the immune system abnormally attacks its own healthy tissues and organs, especially lungs, bones and joints. So, bone and joint pain tends to be one of the most common clinical signs of most autoimmune diseases. 5. Sickle cell anemia. It's an inherited disease in which red blood cells has an abnormal morphology, so these abnormal blood cells have a functional defect in carrying oxygen and other nutrients to the body tissues. Sickle cell anemia is mainly manifested with recurrent episodes of bone and joint pain. 6. Bone tumors or metastatic cancer which extends to the bone. It usually results in severe bone and joint pain, especially in late stages of cancer. 7. Bone and joint pain tends to be common during pregnancy by the effect of hormones, but it's spontaneously relieved after delivery. Symptoms associated with bone and joint pain varies according to the causative factor. For example, tissue swelling in cases of trauma, fever in cases of osteomyelitis, muscle cramps in cases of vitamin D or calcium deficiency, etc. In general, bone and joint pain is usually associated with limited mobility, especially when the bones and joints of the limbs are affected. Diagnosis of bone and joint pain is initiated with local examination by a specialized doctor, as well as asking the patient some questions to know site of pain, course of the pain, any other symptoms accompanying the pain. After that, the doctor will ask for lab and radiological investigations to identify the cause of bone and joint pain. They include the following: complete blood count, CBC, and ESR. Blood tests for calcium and vitamin D deficiencies. Tumor markers. Radiological examination. X-ray, ultrasound, CT, MRI. Treatment of bone and joint pain depends mainly on identifying the cause, then managing it properly. Also, it's advised to do the following. Medications. They include painkillers, local and systemic, non-steroidal anti-inflammatory drugs, corticosteroids, muscle relaxants, vitamin D and calcium supplementation. Stretch exercise. Ice packs and hot fomentation. Physiotherapy and massage. In conclusion, we hope that we have helped you with all you need to know about causes, symptoms, diagnosis and treatment of bone and joint pain. Support the channel to encourage us to publish more.